Hey there everyone, in the previous video we had studied the lumbar plexus of the lower limb, and in today's video we are finally going to start the front of the thigh, which is the third chapter in the lower limb. So this video will be divided into three sections so that it will be easier for you to understand, and it will be divided into smaller sections so it won't take much of your time. And also please make sure to watch the video in 1.75x or 2x for saving your time. So let's get started. What is thigh? So, what is the definition of the thigh? Thigh is the portion that extends from the hip joint to the knee joint. The portion that lies between the hip joint and the knee joint is called as the thigh. So the thigh, it is divided into three compartments, that is the anterior compartment, the medial compartment and the posterior compartment. Okay, so in today's video we are going to deal with the anterior compartment of the thigh. It is also called as the front of the thigh or the extensor compartment of the thigh, or it is also called as the femoral compartment of the thigh. So we are going to see the surface landmarks first. So we are not going to go in depth because it is not of great importance, but we just have to know the basics, right? So we are going to see what all are the surface landmarks. So the iliac crest is one of it, and the anterior superior iliac spine. Okay, the anterior superior iliac spine, there are two spines, the anterior superior iliac spine and the anterior inferior iliac spine, but here it is the superior iliac spine. And then we have the inguinal ligament, then the pubic crest, the greater truncator that is present on the femur, and the patella, as we have already studied that it is the largest sesamoid bone in the human body, and then the tibial tuberosity that is present on the tibia bone, which is the medial side of the bone, medial bone. Okay, now we are going to study the skin and the superficial fascia of the thigh. So the skin the skin around the pubic symphysis contains hair, as we all know that it contains hair. And the stitches that we see in the cadavers, we see the stitches because they have added preserving chemicals in there, and then they have stitched it so for embalming and stuff. So we see the stitches in the cadavers. Okay, now the superficial fascia. Okay, the superficial fascia, the fascia, it is divided into the superficial fascia and the deep fascia. We are going to study the superficial fascia. Okay, just remember that the superficial fascia, that is the modified superficial fascia, it is also called as the cribriform fascia, and that covers the saphenous opening. Okay, we're going to study the saphenous opening in this video itself, okay, in the subsequent parts. Okay, the superficial fascia, it is divided into two layers again, that is the superficial fatty layer and the deep membranous layer. All right, so the superficial fascia, it is divided into two layers. The first layer is the superior, this is the superior fatty layer, and beneath it is the deep membranous layer. So this is the deep membranous layer, and this is the whole of superficial fascia. This is the superficial fatty layer, and this is the deep membranous layer. All right, and they are continuous with the anterior abdominal wall, and these two layers are continuous with the anterior abdominal wall. All right, now the membrane layer is close to the deep fascia except near the inguinal ligament on the horizontal line, which is called as the Holden's line. That is called as the Holden's line. So this is the membranous layer. So this is the membranous layer. It is close to the deep layer. So the deep fascia, this is the deep fascia. It is closer to the deep fascia, but except for the inguinal ligament, and this region or this line is called as the Holden's line. How to remember this? Just remember that this deep fascia, it is holding the deep membranous layer of the superficial fascia. It is holding it, so just remember that it is the Holden's line. Okay, now the contents of The superficial fascia are of course the cutaneous, right? So of course the cutaneous nerves, the cutaneous arteries, the great or the long saphenous nerve and its tributaries, and the superficial inguinal lymph nodes. And you see the thing that I have done here, that I have used yellow for the nerves, red for the arteries, blue for the veins, and purple or pink for the lymphatics. All right. Okay, so now we are going to study the cutaneous nerve, but remember that we have already studied the cutaneous, all the nerves in the lumbar plexus. We have seen the ilioinguinal, we have seen the genitofemoral, we have seen the cutaneous nerve of thigh, we have seen the obturator nerve, but not the sphenius nerve, because it arises from the lumbosacral plexus, that we will cover soon. All right, so the genitofemoral nerve, it again divides into the femoral branch. So the ilioinguinal, the femoral branch, the lateral cutaneous nerve of thigh, the intermediate cutaneous nerve of thigh, and the medial cutaneous nerve of the thigh, the saphenous nerve, and the lateral branch of the obturator nerve. So these are the cutaneous nerves that are present in the superficial fascia. Now what are the cutaneous arteries? So let me explain you guys that this is the saphenous opening, whatever this you can see. So this is the saphenous opening. Okay, so from that there are three arteries that are arising. So this is the pudendal artery, and this is the epigastric artery, and this is the circumflex iliac artery. All right, and these, remember, these are the superficial arteries, because we are studying the superficial fascia. It is very much obvious that these are the superficial or the cutaneous arteries. Okay, so it is a superficial artery, superficial pudendal artery, superficial epigastric artery, and the superficial circumflex iliac artery. So what does it do? The pudendal artery, it supplies the external genitalia. Just remember, pudendal is a word in another language that my teacher has told me, but I don't remember which language it was. Yeah, so it is a pudendal, which means shame. So it's just remember that it supplies the external genitalia, and it also supplies to the spermatic cord and the scrotum in the males, and in the females it supplies the external genitalia. Okay, the epigastric, it supplies the lower part of the abdominal wall. So just remember, wherever there is a gastric word, then it is related to the abdomen. So epigastric, it's okay, so supplies to the lower part of the abdominal wall. Okay, and the circumflex iliac artery, it goes near the iliac crest and forms anastomosis with the arteries that lie that are coming from the posterior side, the medial side, the lateral side. It forms the anastomosis, and as we know that we are really good at anastomosis, right? So we will cover it soon. And this is the thigh. Okay, so let me show you guys that this is a thigh, these are the arteries, and this is the saphenous opening. Okay, so yeah. Okay, now the epigastric and the pudendal, both of these, they pierce the cribriform fascia. I had told you in the beginning about the cribriform fascia. What is cribriform fascia? The cribriform fascia is the modified superficial fascia of the thigh. It is the cribriform fascia, and the epigastric and the pudendal arteries, they pierce the cribriform fascia. Okay, so we are done with the arteries, we are done with the nerves. Now we are going to study the veins. So the greatest vein in the lower limb is the saphenous vein. Okay, it is the saphenous vein. All right, so this is the thigh, and this one that you see here is the saphenous opening, and the color that is in the light blue, as you can see, this one is the long saphenous vein. Okay, it is coming from the saphenous opening. This is the long saphenous vein, and this is as we have already seen about the arteries, right? So this is the pudendal vein, this is the epigastric vein, and this is the circumflex vein of the thigh. All right, and this is the posterior medial vein of the thigh, and this is the anterior lateral vein of the thigh. Okay, just remember the PM, so the AL will be easy to remember also. Okay, The saphenous nerve, it is the largest and the longest superficial vein of the lower limb. Why superficial? Because honey, we are studying the superficial fascia. Okay, so it is the largest and the longest superficial vein of the lower limb. Its course is that it begins from the dorsum of the foot, medial side of the dorsum of the foot, to the medial side of the leg and goes behind the knee. Okay, from the dorsum of the foot to the medial side of the leg and behind the knee, and it terminates and its termination, it reaches front of the thigh. Okay, from the back it comes to the front and it reaches the saphenous opening and continues as the femoral vein. Saphenous opening, it is of a greater importance as I have already mentioned. So this is the saphenous opening. It terminates into the saphenous opening and then continues as the femoral vein. All right, now its tributaries are, I have told it so many times now, it's the pudendal vein, the epigastric vein, the circumflex iliac vein, and the anterior lateral and the posterior medial vein of thigh. So we are done with the cutaneous nerves, cutaneous arteries, and the cutaneous veins. Now we are going to study the lymph nodes. Okay, so the lymph nodes, that is the horizontal lymph nodes and the vertical lymph nodes. Into the horizontal we have the upper lateral, the upper medial. See, this is the upper lateral, this is the upper medial, and this is these are the lower lymph nodes. All right. So so this is what, from where does it collect? The lymph is from this one, the upper lateral. It collects from the abdominal wall, the umbilicus, and the buttocks. And the upper medial, it collects from the abdominal wall, the skin of the perineum, and the perineal region. And the lower ventral side, or the lower lymph nodes, they collect the lymph from, or drain the lymph in from the lower limb. Okay, and we have seen that this is the saphenous nerve. It is coming again and again. Okay, so we are done with the lymphatics. Now come to the bursa. Okay, so the bursa, it is divided into the subcutaneous bursa and the deep bursa. You remember in the introduction to the lower limb, I had already told that the knee joint is a very complex joint and it contains 12 bursa. All right, so it is the bursa, main bursa, it is divided into the subcutaneous bursa and the deep bursa. Okay, the subcutaneous bursa is the prepatellar bursa and the infrapatellar bursa, and the deep bursa is the suprapatellar bursa and the deep infrapatellar bursa. Okay, so so now we are going to study the deep fascia. Okay, we have studied the superficial fascia, its contents, nerves, arteries, lymphatics, and now we are going to study the deep fascia. Okay, the deep fascia. Okay, it is called as a fascia lata. Okay, the fascia lata, it is a tough fibrous sheath that is present in the thigh. It is the fascia lata. Just remember the name of the fascia lata. Okay, its attachments are on the superiorly and inferiorly. It is attached. So just remember, whenever you are studying the attachments, just imagine or picture the bone or the basic things. Just picture it in your mind. Just imagine, and imagine which is anterior, which is posterior, and it will be very easy to remember the attachment. So on the superiorly, anteriorly we have the inguinal ligament. Okay, anteriorly it is on the front side and it is on upper side, that is on the superiorly. Okay, so it is the inguinal ligament. How easy it is. Okay, on the posterior we know that posterior surface, it is the gluteal region. So the gluteal fascia, the sacrum, and coccyx. Okay, and on the laterally we know that the hip bone, it contains the iliac crest on the lateral side. So how easy it is to remember. And on the medial side we have the pubic arch and the ischial tuberosity of the bone. Okay, so see, anteriorly inguinal ligament, posteriorly gluteal fascia, laterally iliac crest, and medially pubic arch and the ischial tuberosity. So this is superiorly. And now the inferiorly, we have only anterior and posterior. So anterior, it is the subcutaneous bony prominence, that is the patella or the knee capsule. And on the posterior we know that it is the popliteal fossa or the fascia, and fascia of back of the leg. Okay, it is very easy to remember if you imagine it, if you picture it in your mind. It is going to be super easy to remember the attachments. Okay, so if the attachments are clear, let's move to the next part, that is the modification of the fascia lata. Okay, the fascia lata, it is modified. Okay, it becomes 5 centimeter thickened. It thickens 5 centimeter to form a wide band, which is called as the iliotibial band. It is called as the iliotibial band. Okay, now it has again the attachments. On the superiorly, it is the superficial lamina attached to the iliac tubercle crest, or the crest of the iliac tubercle. And then we have two and then we have deep, the superficial to the iliac tubercle, and to the deep to the hip joint. Okay, now inferiorly, the smooth area of the anterior surface. Okay, inferiorly it is the smooth surface of the anterior surface, and laterally it is the condyle of the tibia. Okay, the lateral condyle of the tibia. Okay, I'm sorry, the lateral condyle of the tibia. Now we are going, what is the significance of the modified fascia lata? Okay, what is the significance of this? It is also called as the iliotibial tract, right? So what is the significance of the iliotibial tract? Okay, there are two significances, that it is a site for the muscle attachments. Okay, so there are two muscles that are attached on the iliotibial tract or the fascia lata. It is 3/4 parts. Okay, just remember the 3/4 parts. It is the gluteus maximus muscle from the posterior side and the tensor fascia lata. Okay, so just remember that there are two muscles that are attaching to this, and it is its significance, and it stabilizes the knee joint during partial flexion, extension, and while walking it stabilizes the knee joint. So the significances are for the muscle attachments and stabilizing the knee joint. So now we are going to study the very easy and the very this is one of my favorite topic. So this is the saphenous opening. Okay, we are going to see the saphenous opening. So it is a oval opening in the fascia lata. It lies in front of the femoral sheath. Okay, it lies in front of the femoral sheath, all right, because it's an opening, and it is closed by the cribriform fascia, that is the modified superficial fascia that I have already told twice. So it is closed by the cribriform fascia. Okay, now so this is the saphenous opening, and these are the epigastric vessels, that is the epigastric vein and the epigastric artery, and this is the pudendal vessels, that is the pudendal artery and the pudendal vein, and this is the, as we know that this is the saphenous opening. It is 2.5 centimeter long and 2 centimeters width. Good if you remember. If you can't remember, it's like it's okay. Okay, and this is the great saphenous, great or long saphenous nerve. You can also call it as long saphenous nerve or the great saphenous nerve, and this is the inguinal ligaments. Okay, so we are done with the saphenous opening. Now we are going to see the intermuscular septa, that is the last topic of this video. So the intermuscular septa, it is divided into the lateral intermuscular septa, the posterior intermuscular septa, and the medial intermuscular septa. Okay, so we have to know that the thickest septa is the lateral septa. It extends from the iliotibial tract to the lateral lip of the linea aspera. So the linea aspera is present on the femur. For that you need to study the bones. If you want to study the bones, please let me know in the comments, and I'll make a video about osteology of the lower limb. All right, so it separates the anterior and the posterior compartments. Okay, it separates the anterior compartment from the posterior compartment. Which one? The lateral one. Okay, so the posterior is, it is the poorly defined septa, and separates medial compartment from the posterior compartment. Just I'll tell you how to remember that. Okay, so the medial compartment, it is attached to the medial lip of the linea aspera. Okay, see, the lateral one is attached to the lateral lip of the linea aspera, and the medial one is attached to the medial lip of the linea aspera. How easy it is. And it separates the anterior compartment from the medial compartment. Okay, so the posterior, how to remember this? Just remember PM. P for posterior and P for PM, and it separates the posterior and the medial compartments. And the medial, remember, AM. This is the PM and this is the AM. So it separates the anterior and the मीडियल कंपार्टमेंट एंड जो बचा है वो सेपरेट करता है एंटीरियर कंपार्टमेंट को पोस्टीरियर कंपार्टमेंट से. ओके, सो दिस इज द डायग्राम दैट वी हैव टू सी. सो दिस इज द स्किन एंड दिस इज द facial lata, and this is the anterior side, this is the medial side, and this is the posterior side. Okay, and this one that you're seeing here is the femur bone, and this is the femur bone. All right, and see, as I have already told that the posterior, P say posterior and P for PM, just remember it separates the posterior and the medial compartments. So this is the posterior compartment and the medial compartment, it is separating. And we have seen that medial ke liye remember AM, you can remember like Aisha Momin. Okay, so the medial AM, so it separates the anterior and the medial. You see here, this is the medial, it separates the anterior and the medial, and jo bacha hai uske liye you just have to write AP. Okay, so it separates the anterior and the posterior compartments. So these are the intermuscular septas, and we covered a lot of topics, a lot of things. We studied the thigh, the compartments of the thigh, the superficial fascia, the deep fascia, types of the superficial fascia, the saphenous openings, the cutaneous arteries, cutaneous nerves, cutaneous veins. Then we studied the lymphatics and the intermuscular septas, the bursa, deep bursa, superficial bursa, and a lot. Okay, in the next video we're going to study the femoral triangle. Okay, I'm sorry. Okay, the femoral triangle, the femoral sheath, and the femoral canal. And then we're going to study the muscles of the thigh and the vessels of the thigh, like the femoral artery, femoral nerve, and the femoral vein. Okay, and then at the last we are going to study the complete clinical anatomy with a lot of mnemonics. So stay tuned for these videos, and thank you.